Awesome. Thank you. So I can't do two things at once. So, so I'm going to talk to you, as Mike said, about lagging skills and unsolved problems and how to identify them. And we're going to use the ALSUP, the assessment for lagging skills and unsolved problems. And we're going to use collaborative problem solving to help solve these problems. So I'm hoping that our objectives are going to be that you're going to learn to see kids through the lens of lagging skills, that you're going to learn to identify unsolved problems, and learn how collaborative problem solving helps youth and adults resolve issues. And one of my favorite quotes of all time is by Dr. Ross Greene, and it's "Children do well if they can." And I fully believe that. I have seen that over and over and over again with my own child and with all of the families that I've worked with. So children do well if they can. So if they're not doing well, there's something else going on. This presentation is my interpretation of Ross Greene's work, and it comes from these three books: The Explosive Child, Lost at School, and Treating Explosive Kids, and also the Lives in the Balance website. It's all phenomenal work. It's really collaborative. It's really eye-opening. I hope that you will read the books and own them even and lend them out to people. Let's get or send those links. So there's so much information now available online, and I will have links at the end of this presentation for you to get to see some of this stuff. So I would hope that we can bring lagging skills into focus for you. And we're going to talk about what lagging skills are. So there is a worksheet that is out there that has these 24 items on it. And I'm going to go through them quickly, but I want you to understand kind of the flavor of what we're talking about when we say there are lagging skills for these kiddos. You know, they're not things that we often talk about or that we even often know how to put into words. So he's giving us the words that we can use to talk to schools, the words that we can use to talk to families, the words we can use to talk to therapists. So difficulty maintaining focus, difficulty seeing the grays or having a concrete, literal black and white thinking, difficulty handling transitions or shifting from your mindset from one task to another. So far, my son has had all of these. Difficulty taking into account situational factors that might suggest the need to adjust your plan. My kid didn't get that skill for a long time. Difficulty considering the likely outcome or the consequence. I think we see that in most of our kids. I think that's a higher level skill and something that kind of comes in a little later in their development. Inflexible and accurate interpretations or cognitive distortions, often based on biases, such as everyone's out to get me, or nobody likes me, or, you know, it's this kind of people that, or, you know, teachers this, or policemen that, or we hear a lot of those things out of our kiddos. Difficulty persisting on challenging or tedious tasks. I don't know that I necessarily want to read through all of these, but there are 24 of them. I'm going to pick out a couple on each of these next couple screens and keep it moving here. But difficulty appreciating how his or her behavior is affecting others. Our kids really struggle with that, and that often doesn't come for a long time. We know that they have difficulty managing their emotional response to frustrations. So they have those, you know, inappropriate responses of hurting themselves or wanting to hurt others or shutting down or whatever it is. Chronic irritability, anxiety, sensory or motor difficulties. We talk about that a lot. A poor sense of time. You know, maybe it's not that the trouble with transition might be that they have such a poor sense of time that they're not allowing themselves enough time to make the transition. Sometimes it's difficult for them to understand what is being said. And oftentimes people will say things like, well, you understand what I mean, right? Or well, yes, or tell me what I just said. And they repeat back what you said, but that doesn't mean they understand it. So when we are using this assessment of lagging skills and unsolved problems, we really kind of want to use it as as a discussion guide, or kind of not as a checklist and something that we're going to put a lot of time in, but it's just kind of a guide to help us start to see these kids through that new lens of them having lagging skills. We want to focus our discussions on the unsolved problems now. So now that we kind of understand these lagging skills, what are the unsolved problems? Don't worry about explaining why or any hypotheses or theories about why. We're just going to explain the problem. And I promise you, I'm going to give you some examples. But go through the list of all those lagging skills and discuss each one with whatever team you're working with. And then we'll, once we endorse a lagging skill and say, yes, this kid has that lagging skill, then let's try to identify any of the unsolved problems that are associated with that. So the expectation that a child is having difficulty meeting is really what the unsolved problem is. So some examples of what that looks like are going to be, let the school help you. So we're going to talk about school prompts. So if you were working with a school team, you would say, we're going to try to find these unsolved problems. Can you help me understand, are there specific tasks or expectations that the student is having difficulty completing or difficulty getting started on? And they might say, yes, they never get their supplies out when I say, we're going to get started and turn to page 53. Well, they don't even get their book out. So that's definitely an unsolved problem. We don't want to know the hypothesis or the theory about why they're not getting their book out. We just want to say that that's the unsolved problem, is they're not getting their supplies out to start. We want to ask schools, are there classmates or maybe even staff people that the student is having difficulty getting along with? And then under what conditions? Maybe, this kiddo only has a problem with Johnny during music class. Or maybe, it's one particular teacher and it doesn't matter which one it is, but it's whatever class comes after lunch or after recess. So, we're trying to be real specific and get to the, what the unsolved problem is. Are there tasks or activities that the student is having difficulty moving from or moving to? Again, be real specific and figure out what it is. Don't guess why it's happening. We don't need to know that. I know we often talk about the function of a behavior, and that's important, but not when we're using this model at this time. So you can prompt the school team, are there classes or activities that they're having difficulty attending to or being on time to? And you can actually ask them anything. And I think most of your prompts are going to start out with, are there times when there's a difficult moment, and then whatever it is that you think of. Because some of the unsolved problems that you're going to see are things like, shifting from one specific task to another. And again, you're going to be specific. Maybe he always has a hard time getting ready to go to art class, or maybe he always has a hard time going from breakfast in the morning into his first academic class of the day. We talked about starting on assignments, interactions with this particular staff mate, avoid writing assignments. Oftentimes we have kiddos that just don't do well with writing, and people think, well, their writing skills are fine. Sometimes it's that mental space, of what you have to do. But people, we don't care what the hypothesis or the theory is of why they're doing it. We just want to get to that unsolved problem. So just get a list of those going. And I think this is great when a team comes and says this kid's out of control or whatever's going on. Let's do the LSUP. Let's pull this out and let's work this. You can do it pretty quickly. If you were having problems in the home, you can talk about, are there chores or tasks or activities that they're having difficulty completing or starting on in the home environment? Certain people that they have a problem getting along with, whether it's siblings or neighbors or friends, or, is there some aspect of personal hygiene that the child struggles to complete? And again, these are just prompts. You can prompt anything that you want. We're just looking for some unsolved problems. And some examples of unsolved problems in a home environment might be they have trouble waking up or getting out of bed in the morning. They don't complete their morning routine to get ready for school. Maybe they have sensory hypersensitivities to seams in their socks or tags on the back of their shirts. Maybe they don't like to wear shoes. Maybe they don't have a hard time starting their homework. Maybe they have food choice or preference or timing issues around food. A lot of our kids have problems with, time in front of a screen and feeling like they're not getting enough or not able to get away from it. Those are unsolved problems. Going to bed, being bored, cleaning their room, doing their chores, taking medicine, riding in a car because they don't want to wear a seatbelt. So again, we don't want to know why they don't want to wear a seatbelt, and there might be a very good reason that makes perfect sense to you. We don't really care about the function of that behavior at this point. We're just talking about that's an unsolved problem. The kid needs to wear a seatbelt when they're in the car and they won't. So some guidelines that you can use when you're trying to write these would be that you don't talk about the behavior. So example, if Johnny screams and swears when he's having a difficult time completing a word problem on his math homework, we're not going to talk about the unsolved problem isn't that he's screaming and swearing. The unsolved problem is that he has difficulty completing the word problems on his math homework. It's very specific, but yet it's not talking about the behavior. Obviously, if he's screaming and swearing, there's a problem underneath, and that's his response to it. So we want to get to the problem. You're not going to, give a theory. So example, you're not going to write, that, he has difficulty writing the definitions of his spelling words in English class. And then you're going to say, because he likes the girl in front of him and he doesn't pay attention, or because he just came from recess and he's too tired. We don't care about the hypothesis or the theory behind it. The problem is that he has difficulty writing the definitions in English class. And we don't want to clump them into one category, and we want to be real specific. So we're not going to write that he has difficulty getting along with others, even though that might be the overarching kind of umbrella, but we want to be specific. So, he has difficulty when he's playing with Chad agreeing on the rules for Foursquare during recess. Real specific about who, what, where, when, and some strategies that you can use are to include the details that we just talked about, and what expectation is the child having a hard time meeting. So, in this case, it would be following the rules. And then the who, what, and where is with Chad playing the Foursquare game, and it's during recess. So now we're going to talk about making some connections, which honestly, the lagging skills and the unsolved problems and identifying them can be really difficult. To me, the crux of it is this piece of making the connections and solving the problems. And I will tell you that when I did this with my own child, I read this book when my son was 6 years old, and it totally changed my life and my relationship with my son. So we were having a lot of timeouts. He was going in timeout a lot, and because he wouldn't do what was asked of him. And I wasn't going to let him get away with that, because I knew that you have to make kids follow the rules, and they have to do what the parent asks them to do. And they, this society is rule, you have to follow rules. It's made up of rules. So I wanted my child to follow rules. I was raised by a dad who was a Marine. When my dad said jump, we said, how high you want us to jump? I followed the rules. I'm a rule follower. I now say, if I don't like your rules, I'm going to make you change them, but I'm going to follow the rules. But my kids struggled to follow the rules. And it was getting to the point at age 6 that I was starting not to like my son. And I think he certainly wasn't liking me, because I was putting him in timeout a lot. And he and I sometimes would both end up in tears, because it would take us an hour and a half of me repeatedly putting him back in timeout, him crying and screaming to the point that after an hour and a half of it, I'm crying. It wasn't getting us anywhere except making us frustrated and angry with each other. And I didn't like who I was becoming, and I didn't like my relationship with my son, and something needed to change. And then I read this book, The Explosive Child, and oh my goodness, did things change. Now, it took me probably a good year to understand how to really identify those unsolved problems and those lagging skills. And I took a lot of practice, because I promised you in that year's time, I had lots of practice to do this. But I was really, really dedicated, because nothing I was trying was working. So I tried this collaborative problem solving approach, which he now terms it collaborative and proactive solutions, or CPS. And the good news about this model is that it is evidence-based. In schools, we're required to use evidence-based practices. I think it's just a good rule in general, but schools are required to use evidence-based models. It focuses on identifying the problems that are causing these concerning behaviors in kids, solving them in a collaborative and proactive way. It does not emphasize the use of consequences, neither positive nor negative, to modify the behaviors. And it actually has a track record of improving behavior and reducing discipline referrals, detentions, suspensions, restraints, and seclusions, not just in schools, not just in homes, but in juvenile detention facilities, hospitals, residential placements. This is something that works. I will tell you that my son, who is now 24 years old, and I have a super wonderful relationship because of this model. And I've even seen him use this model when we were training our dogs. And it was really kind of cute to see that he was concerned about making sure that the dog's need got met, as well as whatever we needed from the dog. So CPS is non-punitive, non-exclusionary. It's trauma-informed. I say it's trauma responsive. It's transdiagnostic, and it's transcultural. This model really can work. And it's simple. There's a plan A, a plan B, and a plan C. And, plan A is, I think, the plan that I went into parenting with, that I'm going to impose my adult will because I'm your mom. I said, go brush your teeth. I said, clear the table. I said, go out and play. Whatever it is that I said, you're going to do it because I'm your mom. I heard that growing up from my mom a lot, because I'm your mom and I said so. And I did it. My son didn't do it when I said it. Imposing an adult will is considered a plan A in this model. Plan B is to solve the problem collaboratively. Doesn't that sound nice? I mean, who in your work environment doesn't want to work with your team or your supervisor to solve whatever problems come up in a collaborative way? And yet we often don't include our kids when we're talking about being collaborative and solving problems that involve our kids. We're not letting them be part of the solution. We let them continue to be part of the problem. And then there's a plan C, which is to drop it, at least for now. I like to call plan C as kind of choosing your battles. And it's okay. It's okay to decide not to make brushing your teeth an issue if you've got more important issues. I want to tell you that I use the example of brushing the teeth, and I'm going to share how collaborative problem solving changed two things for my son and I, and this is how I knew that it worked. I talked to you about having a hard time getting him to stay in timeout. So I read this book and knew about plan A, plan B, and plan C, and I realized, well, I really can't let, when he's having an opportunity where he's melting down and having a fit over something, or just not able to manage himself, I can't just let it go. I have to help him. Of course, I don't know why, but I thought, well, putting him in timeout is helpful because that's what I was told. So I tried this method and I sat down with Alex and I said, okay, buddy, he was 6 years old. I said, okay, buddy, when you're having a meltdown and having a hard time, mom wants you to have a timeout. A timeout isn't a bad thing. It's just a place to go, to sit down, chill out, regain control of yourself. And then we can, work on whatever is going to happen next. Mom takes time out sometimes. She goes to her room, to the bathroom, wherever I can go to get away from everybody for a minute, to clear my head or pull myself together or whatever, take some deep breaths, whatever. Timeouts are not bad. I need you to take a time out. And he said to me, so that was my problem. I needed him to take a time out. He said, well, my problem is that I don't like when you put me in timeout, you put me in my room and I can't see you when I'm in my room. This is what my 6-year-old is telling me. And I said, okay. So in identifying the problem from his perspective and from my perspective, I'm now engaging with him to try to solve this problem. So I said to him, and I'm telling you, I didn't think it was really going to happen, but I said to him, so you're telling me if I give you a timeout, someplace where you can see me, you'll stay in timeout? I've been struggling with this kid for probably 3 years with trying to get him to stay in a timeout. And he said, yes, Mom, I will. And I said, okay, where do you think would be a good place to have a timeout? And he said, if we made it the rocking chair in the living room, I would go sit there as long as you would stay in the living room or the dining room so I can see you from the rocking chair and I will stay there. I said, okay, we're going to try this. I had nothing to lose at this point because I already had a bad relationship, or I was on the way to creating a really bad relationship with my kid. I had a lot of anger and frustration towards him and he towards me. So I had nothing to lose. Everything I was trying wasn't working. So, okay, we're going to try this. So the next time he had a little fit over something, I said, honey, why don't you go have a timeout? And he went right to the rocking chair and he sat down, and I went and I sat on the couch, and I honestly, I picked up the newspaper, I remember, and I was holding it up and reading it because I didn't want to see him because I was afraid I was going to start laughing or smiling or something, because I was like tickled pink that he was sitting in the rocking chair for a timeout. We had never had this happen ever before. And I thought, okay, I'm onto something here. This Ross Green is onto something here. And I continue to use this plan for, honestly, I still use it now, and he's 24 years old. He actually uses it on me too. So it's kind of interesting, but I got to meet Ross Green. He came to Akron Children's Hospital a few years into me using this model, and I was like gushing all over him. I was like, you've changed my whole life, and you've changed my whole relationship with my child, and helping me see my son through the lens of having these lagging skills and unsolved problems, and working with him to identify his problem in this. It really helped me to have this great relationship with my son, and thank you so very much. And I promise you, it wasn't all roses from there on out, but it gave me a model to use to help my son and I work through these problems. And another example I'll use is brushing teeth. I really wanted him to brush his teeth. I didn't want to have to pay for braces or a bunch of cavities or fillings, and I just really wanted him to brush his teeth. He did not want to brush his teeth. I thought, well, it might be a sensory issue. It might be this. I don't know what it is. He wouldn't brush his teeth, couldn't get him to brush his teeth on a regular basis. So I employed this method of collaboratively trying to solve the problem and understanding what his need was. And I said, Alex, why won't you brush your teeth? Again, he was 6 years old. He said, Mom, I don't like when I brush with the toothpaste and it all foams up in my mouth. I don't like the way that feels. So we happened to be going to the dentist, and I explained to the dentist that this is what Alex said. And he said, well, just have him brush his teeth with water. It's fine. He doesn't need to have toothpaste. So I said, okay. So Alex heard what the dentist said, and I said, well, why don't you try brushing your teeth with water and see if that helps? And he said, okay. So he brushed his teeth with water, and he said, Mom, it doesn't bother me anymore because it doesn't foam up in my mouth and give me that weird feeling. So I can brush my teeth using water. And I was like, are you kidding me? I've been fighting with this kid for years to brush his teeth. And all it took was me asking him what the problem was and letting him help me solve it. This is from a 6-year-old, and thankfully, Alex now trusts that I'm going to collaboratively solve the problems with him. So he trusts me to tell me what the problem is from his perspective. I trust that he's going to hear it from my perspective. And we both trust that we're going to work it together to solve it. And it's making me cry. So children do well if they can. So please consider this model. Please read these books. Here's some links that will come out for you to look at. The ELSA, the guide to using it, and the Lives in the Balance talks a lot about using collaborative problem solving, and it really is wonderful. And I'm sorry I had to go so quickly and talk so fast, but I needed you to understand these 3 different pieces. So thank you very much.